The Manitoba Advocate for Children and Youth wish to acknowledge that we are located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and the beautiful homeland of the MACY Nation.
So, welcome back. We are here this week to talk about TRC discussions. And
TRC discussions, episode 4.
Wow.
So today's call to action will be number 2, and we're going to jump right in. So today's call to action is that we call to action the federal government in collaboration with the provinces and territories to prepare and publish annual reports on exactly the number of children, Aboriginal children who are in care compared with the non-Aboriginal children, as well as the reasons for apprehension, the total spending on preventative and care services by child welfare agencies, and the effectiveness of various interventions.
And you know, we talked about this just a couple seconds ago, and I love the youth voice.
Yes.
Because it just, when you talk to a youth and you hear the adult version of, and we all know there's certain reasons why, you have to have this wording to cover things. When you ask a youth what this meant and what this means, and in this great book that you have here, I really like it. I'll let you read what Mika N.
So Mika, from this book that we're borrowing, and it has such a simplistic, that was very wordy even for me to read, but he just says, report Aboriginal children in care, total spending and effectiveness. Bam, broke it right down, simple, right to the bone. So one of the things that when I was reading that, I realized that this is a threefold call to action, because they're asking to say how many kids versus non-Aboriginal. So they want to know what the Aboriginal number is. When I first started doing this endeavor to talk about TRC, I was looking at different numbers, like the number varies of Aboriginal children in care, depending on some of the formulas, whether it be a federal number, whether it be a provincial number. Those are still children in care. Those are members of somebody's family. So that's creating that rift in the community for unhealthiness, to be able to not. So the agencies are dealing with different things. We have agencies that are now, lots of the agencies are looking at taking over their own Aboriginal child welfare mandates. So they're writing policy. They're working hard to bring the children home to communities that have their family. If it's not family, it's someone in their communities. Those policies have been started, and that is a big step. So this is an endeavor that is being looked at very hard and diligently by our First Nation governments, by our First Nation communities, and by families that are very concerned. They don't want to have the legacy of residential school. They don't want to have the legacy of the 60 scoop. They want their children home in their communities. So this is a good call to action that is being revised and worked on as we speak. Many agencies, many communities across Canada have been working long and hard to not so much the single envelope funding as to what is programming and effective, but also what they are doing. They understand the need to have their own children in their own communities with, if not family, with community members, to provide that sense of belonging, to provide that inclusion, and to keep them where they need to be in their own homes. So this is how we're being effective. This youth voice is very important, because they realize that most Canadians mainstream don't understand what's going on and why the numbers are so high. This goes back to the non-education, non-awareness, what we were talking about with the reconciliation. That people don't know about residential school. They don't know what the trauma of the 60 scoop and child welfare has done to families. They could not imagine their families being torn apart,
Mhm.
and what that means for a child that's placed in that stream. So we're looking at from a child voice and being able to say, yes, this is a TRC call to action that is being implemented, changed, worked out in very many. So this is an action that is actually being worked on today and has been for some time. We've had lots of discussion at all government levels, Indigenous governments, agencies, child welfare organizations. They're all looking at. So this is a call to action that is very, it's not being passed over. So this is one that is really in the action.
And it's not just about, to me anyway, it's not just about bringing the numbers down. And because I read into the youth voice, what he says there, report Aboriginal children in care. So we're looking at the numbers, total spending and effectiveness. So it's a lot more than just getting the numbers down. It's how are the numbers being brought down and what spending is being used and how effective that is being done. So it's
here in Manitoba, we've just changed the process again. So it's gone from there's no more respite. There's, depending on the agency, there's a lot of programs. So one envelope. If you've been in the child welfare game for as many years as I have, they know the process and the changes that worked, the changes that didn't. So it's all based on government formula. So we have to look at the total spending and effectiveness.
Yeah.
Well, it all comes out with the children being able to have the needs that their needs are being met. So whether that's respite, sports, therapy, recreation, respite, it all comes down to, is the child's needs being met? So that's where the effectiveness comes in.
Because you can throw money at things, but if you, as the youth voice is saying, if you're not evaluating the effectiveness of that money, right? So at the end of the day, I like that because it's not just giving the solution as give money to a problem. It's about how effectively used to make change. Again, so you're evaluating and you're again just seeing the effect as opposed to just throwing the money and assuming that that's going to solve the issues, right? And that I really like this youth voice simplifies it so well to what this call to action speaks to.
So being able to also understand that we have various interventions, the effectiveness is very key to be able to, we're just in the first 3 months of this, or the last 3 months of this fiscal year, but April 1st is a new budget, so we'll see how, because they've had one full fiscal year to be able to measure. So now is when the numbers will really show if it is being effective or not. Some say yes, some say no. Being able to understand that. So that's our call to action. Next week we'll be talking about the call to action number 3, and that's around the Jordan's Principle. So we'll be having a little discussion about that. They just had a very big 3-day Jordan's Principle conference, and one of our staff members was attending that. So we'll be able to talk more about Jordan's Principle next week for TRC number 3. And we have to say thank you and remembering to use social distancing, frequent hand washing, masks, all the public orders to be able to be safe and healthy in our communities.
I'll just say thank you for joining us for this week's TRC discussions, and hopefully, you join us again next week. You see what we're going to be talking about for episode 5. It's going to be a good discussion and a lot of useful information, I feel.
Thank you so much, John. That was awesome.
Thank you.
And hopefully we'll have a couple teddy bears to bring out with Jordan's Principle, because that's how it started with our little Jordan Anderson.
Yes.
Jordan River Anderson was the boy that started with
Remember
Jordan's
that
Principle.
name.
So thank you for joining. And my name is Cheryl. I'm the Knowledge Keeper here at the Manitoba Advocate for Children and Youth. And we'll see you next week.
MGJ.